Within 5 years of the campaign, World Obesity Day was launched as an initiative of the World Obesity Federation. The first World Obesity Day took place in 2015 globally. Till the year 2019, it was observed every year on 11th October, and since 2020, it's been observed on 4th March every year, with an aim to increase awareness of the root causes of obesity and encourage advocacy for change. This year, World Obesity Day 2022 is observed with the theme, Everybody Needs to Act. I'm Dr. Pooja, Assistant Professor, Department of PG Studies in Swasthavavrtta, is happy to host this special event. As we all know, on this occasion, we have gathered here for the guest lecture on the topic, Etiopathogenesis and Management of Obesity by our eminent guest speaker, Dr. Ashok Patil, Professor, Department of PG Studies in Swasthavavrtta, BMK Ayurveda Medical College, Belagavi. Now, I request our HOD, Dr. P. Sudhakar Reddy, to welcome everyone to the gathering.
Namaste. Good afternoon to all. My humble pranamas to His Holiness Jagadguru Sri Shivaratri Jayasekara Mahaswamiji. It is my great pleasure to welcome you all for this guest lecture program. I would like to welcome our beloved Principal, Dr. Sarveshwar Sir, Dean, Dr. Rajesh Udipudi Sir, all my staff of college and of departments, and PG students and UG students for this guest lecture program. And also, I would like to welcome our special guest today, Dr. Ashok Patil, Professor and HOD, Department of Swasthavavrtta, KLE, Ayurveda College, Belgaum. Welcome you, sir. Welcome you from our institution and all the teaching faculty and students. Hearty welcome to you, sir.
Thank you, sir.
Thank you and all.
Thank you, sir. I also welcome you wholeheartedly for the session. Now I request our beloved principal, Dr. Sarveshwar sir, to say a few words on this occasion.
Namaste, sir.
It's a nice occasion to greet you, Dr. Patil, from Mysore to Belgaum.
Thank you, sir. Thank you very much.
If you'll come here, definitely we won't hesitate to give you the Mysore Pak. And if you'll come there, I know that you're going to feed my stomach with the kundas.
Kundas. Yes, sir.
Yes.
Nice to see you, sir.
At the outset, surrender to the lotus feet of Param Pujya, Jagat Gurus, Shivaratri Jayasekara Mahaswamiji, Sikhata Sutur, to the lotus feet of Param Pujya, Gurudev, Sri Ravi Shankarji, Art of Living, Bangalore, and Param Pujya, Dharmadhikari Sri Virendra Hegdeji, Sikhata Dharmasthala. Dr. Patil, no doubt, this program is intended for obesity, to observe the World Obesity Day. But your knowledge sharing, I know that you are one of the eminent personalities in the field of Ayurveda and so also in the department of Swasthavavrtta, if some people can be counted in India. So I always quote our Reddy sir as a WHO Reddy, because he is a man who could have reached in the different figure, but yes, his knowledge through the books and the knowledge sharing in the different platforms is it is extraordinary, no doubt about it. And that department is doing maximum seminar webinar, Dr. Patilji. This is a message from my end to you.
Yes, sir. Yes,
I know that you have molded by your former principal, Dr. Prasad sir, and you are also equally one eminent principal with you, Dr. Suhas Sethi sir, who has come from the SDM, and where you have also enriched your knowledge at SDM Hassan. I had a great memories with you at Sri Sri. I could see that what as a youngsters, how energetic you are that time. So that was still I carry
Yes.
what you call the vibrations in my mind.
Thank you,
And
sir.
aptly, God has placed you the best place, representing now and the HOD department of Swastavrita. That is once again one of the eminent Nalanda you can call is the Ayurveda Nalanda, that's called as the Keli Ayurveda Belgaum.
Yes, sir.
I hope this program, the intended by the team under Dr. Professor Reddy sir, and their team is ready to deliver the best for the students. So you, and I also invite you. We are entering to the 25th year, Dr. Patil ji.
Yes,
So
sir.
we don't want to see you in the half picture. We want to see you in totality. Therefore, I invite you to be here. So with a box of kunda, and when you go back, definitely I request Dr. Reddy sir. He always call me because he's telling that your belly is going to come up, sir. You don't eat, he's telling me. So therefore, I also concert my food nowadays. But I'm not concerning my nutritions. But I learn from you. With this, viewers, thank you very much. I welcome all our knowledge seekers. Students are here. And over to you, Dr. Patil ji.
Yes, sir.
Thank you, everybody.
Nice, sir. Thank you, sir. Thank you very much for your sweet welcoming note, as sweet as the Mysore Pak. As sir is a senior teacher, and I love to work with sir. And I had also a very sweet memories with Dr. Sarveshwarkar sir and Dr. Sajita madam at Sri Sri. He has guided me in all the aspects, overall aspects, how to work and how to motivate the students and all. Ever energetic, ever enthusiastic, as I was saying since from 15 years, Dr. Sarveshwarkar Sarji, the Honorable Principal of the reputed institution, ASS Ayurveda Medical College, Mysore. I wholeheartedly thank you, sir, for giving me an opportunity to share the few knowledge with your esteemed students who are studying in reputed institutions. I also thank Dr. Sudhakar Reddy, who is a senior professor and my senior friend, guide, who has asked me to share the knowledge regarding the recent advances in obesity, what we are practicing here in KLE Ayurveda, along with the routine Ayurveda treatment. So I want to give highlight about what we are practicing and how we have done the MOU with the collaborating institute and established the new specialty OPD that we call it as Sumeda OPD. So I want to highlight in that aspect as a PG scholars of your institutions. I am also seeing Dr. Rajesh Reddy sir. I am also
1 minute.
Yes, sir.
One minute. We are not given your introduction. Please stay 1 minute.
That's okay, sir.
1 minute. 1 minute. 1 minute.
Thank you to our principal, sir, for saying such inspirational words. Now I request Dr. Sushmita, final year PG scholar, Department of PG Studies in Swastavrita, to introduce our today's guest speaker.
Namaste. Pranams to His Holiness Sri Shivratri Deshikendra Mahaswamiji, respected dignitaries, principal sir, HOD sir, other faculty members and dear students. I will take this opportunity to introduce today's guest speaker, Dr. Ashok Patil sir. Sir completed his Ayurveda graduation at Gadag and post-graduation at SDM College Hassan and awarded PhD at 2016 from RGHS Bangalore. Sir is presently working in KLE BMK Ayurveda Medical College as professor and head of PG studies in Swastavrita and also coordinating all postgraduate departments of the institution. Sir is in charge of Sumeda Obesity Solutions in Ayurveda Specialty Clinic at KLE Ayurveda Hospital. Sir's PhD research work focused on the survey study of village health population with reference to oral hygienic practices among rural India in selected villages. Sir is the renowned West columnist in Karnataka daily newspapers and written more than 100 articles of social issues and human relations. Presently, sir is working on few research projects related to wheat grain and Ayurveda nutraceuticals. On behalf of all faculty members of PG Studies in Swastavrta and institution, I would like to welcome you, sir, to enlighten us with your esteemed knowledge. Over to you, sir. Thank you.
Thank you. Thank you very much. As we have already crossed half an hour as per the scheduled time, I will be bit faster as I could able to see Dr. Rajesh Udupudi sir also. I thank you, sir, and nice to see you, sir, Dr. Rajesh Udupudi sir, with us. I thank once again all the authorities over JSS Ayurveda Medical College institution for giving me an opportunity to share few thoughts and few developments regarding the obesity treatment, what we are practicing here. So let me share my presentation. Sir, I think it is visible to you.
Yes, sir. It is visible.
Yes, yes, sir. As the sir has asked me to deliver regarding etiopathogenesis and specific Ayurveda management of obesity, as I am seeing here, all are PG scholars only. So I don't go in depth regarding etiopathogenesis, but just a few brush up the etiopathogenesis, what we understood in terms of, in case of studying the obesity, that is Taulia. And then I will move on to the, rather than going for the routine Ayurveda treatment, you better know regarding all the aspects of the treatment, what the classics have mentioned in terms of Shamana and in terms of Shodhana, and what recent advances have come up in the field of Ayurveda in concern to the treatment of obesity, where we have done the mutual collaboration with the Jivan Rekha Chikitsalaya at Aurangabad, where Dr. Mukund Sabnis, who has worked a lot along with Dr. Savrekar sir in Maharashtra, Aurangabad. They have come up with a very good research works, many research works and many experiments they have done on the patients of Taulia, that is obesity, and they have come up with a very good medicine, especially Lekaniya Ganadravya Siddha Auchada in Tilataila Murchita. Murchita Tilataila, Murchana is done with the Lekaniya Ganadravya Siddha Auchada, and with that we are getting a very promising results. Now I will end this presentation with one case report in my OPD, what we named it as Sumedha OPD in KL Ayurveda Hospital. With that, we will come to an idea that what advancements are coming up in the field of Ayurveda in concern to the management of obesity. So as the time we have already crossed half an hour, so just I will be skipping the slides. Sir, is that okay, sir? Sudhakar Reddy, sir?
Yes, sir.
Yes, I will be skipping few slides to manage the time so that I will be briefing it. Just I think all are PG scholars only. I am seeing all PG scholars only here, isn't it? Okay, these are the things you know. When we call a person as a staulia, as classics have mentioned that speaks tanodara lambanam, if such symptoms are persisting, if such signs, if we are observing, then we call the person as a staulia. These are the explanations. And as per the classifications of overweight and obesity by BMI chart, as per the WHO classifications, we are having based on the BMI calculations, underweight, normal, overweight, obesity grade 1, 2, and extreme obesity. Depending upon the severity stages, we are calculating this. This physiology of Meda Dhatu, I will be explaining in terms of a chart where Meda Dhatu, which is mobile in nature, we call it as Pochaka and Poshya, which is circulated in whole body, along with the Gatiyukta Rasarakta Dhatu for nourishing the Pocha Meda Dhatu. And as per the contemporary science, it can be correlated with the lipids, cholesterol, which are present in the circulating blood. And Poshya, immobile in nature, which is stored in Medodharaka kala in its sides, that is Udara speaks Stana, and it can be correlated with the adipose tissue. So Nidhana of Staulya, they have mentioned Nidhana of Staulya, that Ati Staulyam, Ati Sampurnam. These are the some of the Aharatmaka and Viharatmaka Nidhana, Manasika Nidhana, and Bija Doshada Nidhana. And Aharatmaka Nidhana, Ati Sampurnam, Guru Ahara Sevan. Here, excessive intake of the food more than the satisfaction. Guru Ahara Sevana. We call Guru and Lagu nature of the foods, not only considering for the in concern to the aspect of digestion, but also we need to analyze that in terms of glycemic index. If at all the food is having a high glycemic index, then I call it as a Lagu Ahara. If at all the food is having a low glycemic index, that it can be considered as the Guru. Why? Because delayed for digestion and suddenly the sugar levels are not going to boost up in the body. Like that, we need to think in that way in concern to the glycemic index and glycemic load. And Madhurahara, one who is indulged in consuming more sweetened foods, Shitahara Sevana, Snigdahara Sevana, nothing but the visible fat. In the concept of visible fat, what the Aharatmaka Nidhana they have mentioned here, all can be proven. And here, Viharaja Nidhana, all the Viharatmaka Nidhana indicating decreases in the physical activity, sedentary lifestyle, which aggravates the kapha and leads to the medo deposition. And as well as the Diva Swapa, due to the Abhishanda property, leads to the micro channels, that is the Srotavarodha of the body, especially in the Medova Srotas. There are stress also a factor, which can be a dual factor, where sometimes it can be a cause for the reduction of the weight, and stress itself is a cause for the gainment of a weight. Because of the stress, only the person starts diversified and binge eating. He starts the habit of binge eating, and thereby the Manasika Nidhana also plays an important role. Especially Acharya has mentioned Harshanitya and Achintana are the two physiological factors mentioned at Acharya Charaka. These factors are kapha aggravating and hence leads to Meda Sanchaya. And next one is the genetic disorders, Bija Dosha Nidhana. Overnutrition, particularly with Madhura Ahara during pregnancy, is mentioned. It is also one of the causative factors for the big baby, the birth of the obese child. So this Samprapti, once again it is mentioned. You all know these Samprapti Ghatakas, the basic Samprapti Ghatakas, before understanding for before going for the treatment aspect. These are the some of the basic parameters where the Staulya can be diagnosed. First thing is Spik, Stana, Udara, Lambana. So these are the basic parameters. Beside the symptoms, the Ashta Staulya doshas, they have mentioned, that is Javaparoda, Krishna Vavayata, Dorbalyata, Dorgandya, Svedabhada, Kshud Atimatra, Pipasa Atiyogascha. These are the prominent clinical features of Staulya as narrated by Charaka. It is not mandatory that all should be there in the diagnostic part, but most of these can be considered, most of these symptoms can be considered to attain for the appropriate diagnosis in case of Staulya. Now, if at all the person fails in understanding the Ahara Vidhi Vidhana, and as well as in understanding the Ashtavidha Ahara Vidhi Visheshayatana, if we fail in practicing, definitely we will end up with these non-communicable disorders, especially these metabolic disorders, first this obesity, hypertension, diabetes, etc. So all these, the concept of balanced nutrition, balanced diet is to be maintained to prevent such diseases as a primary prevention. Now, the therapeutic diet aspects also, many of the preparations can be used after the treatment, in the due course of the treatment. Along with the treatment, these the Patya Kalpanas can be used, like Madhudaka, Kulattayucha, Bharjita Vrintaka, Kapota Mamsa, Takra Kalpanas, Trifala Yavagu, Mudgamalaka Yusha. So these Krutanna Kalpanas can also be used. These also play an important role as the treatment, along with the treatment. Next, Dwadasha pravicharana. As I mentioned, Dwadasha Asana pravicharanas are also to be maintained while the treatment aspects. Now coming to the Staulya Chikitsa, Nidhana Parivarjana is the foremost Chikitsa where all the Aharaja, Viharaja, that is modifiable risk factors can be prevented, where non-modifiable risk factors like age, sex, and genetic disorders can't be modified, whereas the modifiable risk factors can be controlled at its earliest stage. So the treatment will be in Guru Atarpana line of treatment, Langana Chikitsa, then Satata Karshana Chikitsa is to be done, continuous monitoring and continuous applications of the Karshana Chikitsa is to be done, along with the Patyahara. So that let us see what the classics have mentioned. The basic line of a principle of a treatment in case of treating the obesity is Vatagni Annapana, Sleshma Miro Haranicha, Ruksha, Ushna, Basti, Tikshna, like this, Enema, Basti, and by usage of these drugs, especially the Guduchi, Mujta, Haritaki, Pipitaki, Amalaki, administration of Takrarista, like that, depending upon the condition, by the intelligence of physicians. So these principles are to be adopted. So usually, Charaka and Vagbata both have very clearly mentioned in Baudosha Avastha and Shodhana should be performed here. Staulya, Charaka considered it as a Sleshmada Nanatmaka Vadis, that is Santarpaja Nimittaja Vadi. Two main parts of Shodhana. First one is Baya Samshodhana, what the Udvartana type of a treatments, what we are giving to the patients, and next Abhyantara Samshodhana like Basti, Likana Basti, and all treatments routinely we are in practice. Now coming to the Snehapana, as the Jivan Rekha line of a treatment, what I am focusing in this specific interaction is regarding Tailapana. Taila is considered best for the Shamana and is best for the Medo Roga and as well as Kafaja Roga, especially in Staulya. As many acharyas have described Staulyata as Sukumara and contraindicated for Chodhana Karma. So Rusvamatra Snehapana can be used to manage the Staulya. So these are the references where dose of Taila should be in a Rusvamatra. Tilataila is having such properties which is Guru in nature but also does the Amapachana and which works on Kapha and Vata too. So the Taila properties described as Guru and Pachanam Anila, Bala Sakshayakaram and Paneshu, that means it is heavy to digest, helps in the Pachana of Ama, Vata and Kapha, thereby helps in metabolizing the Ama and corrects Vata and Kapha, and it can be given in the form of a Pana. So this is the basic reference from the classics. Now coming to the Lekaniya Dravyas, they are mentioned in the classics test which may help in the prevention and management of Staulya. So here these drugs possesses the Tiktarasa, Ushnavirya, Laguruksha Guna, Katuvipaka and Vat Kafara actions, and thereby the Samprapti Vigatana can be done very easily. Now these are the Bahya Shodhana therapies, whereas Tikshna, Rukshna, Udvartana is advised. You all know. Next, Lekana Basti, which is usually routinely practiced like other bastis like Badradi Astapana Basti, Aragvadadi Niruha Basti, so Erandamula Niruha Basti and Gomutra Basti. Like these other Basti practices are also there for the treatment of this Staulya. Now, coming to the basic body of this topic, that I present the case with the clinical case presentation, let us understand how the lipid disorders can be addressed by means of a specific therapy which is practiced widely by Dr. Mukund Sabnis and Dr. Saurekar in the collaboration what we have established with the Sumedha unit and what we are practicing here. So this is one case out of 200 cases till date since from 2019. The clinic is established in KLE Ayurveda Hospital, and among 240 cases, I am taking few cases here. So the case is 58 years female from the Belgaum, having the complaints of heaviness of the body since 5 to 6 years, pain in both the knees, difficult to do heavy works, unable to perform the fast works fast in time, unable to do the brisk walk, run heavy works, easily get fatigueness because of the heavy weight. Now she took the treatment from local doctors but could not get the satisfying results. Now also she was aware about the market preparations, so she bought some slimming powders and weight reduction powders also, but couldn't find any results. And she tried the fasting therapies like fruit fasting, juice fastings, one meal fasting, like that. Even the keto diet also, fasting she practiced by taking the self medication. And yoga line of treatment at Sri Sri Yoga Kendra also enhanced the, where she stayed for 15 days, but the flexibility is enhanced, but no much weight reduction was there. Maybe due to the dietetic interventions of the bit of weight reduction is there, but not optimal weight reduction. Desired weight reduction was appreciated. So this is the personal history, not not having any specific pointable histories are there, almost common histories, not a known case of diabetic hypertension and not under any related medicines. But she is having the history of back pain, compression of L4 and L5, and she is under NSAIDs. But occasionally she is taking, but she is comfort. She was comfort at that time. Now this is the routine dietetic history where routine diet was tested or interrogated with the patients, and usually outside foods like snacks, oily and spicy food preparation, junk food preparation she used to consume. And also obviously lack of this following of the food regulations like Ahara Vidhi Vidhana and Ashtavidha Ahara Vidhi Visheshayatanas. These were not strictly followed, and these are the Ashtasthana Pariksha and general examination where no much noted things were there. Now systemic examinations, no abnormalities in the systemic examinations, only bulky abdomen while inspecting the GI system and while palpating the GI system, and no any abnormalities in other systems. Now when the investigations were done, lipid profile was asked to perform, and these were the reports of the lipid profile where total cholesterol was up to the mark 194, where high density lipoproteins were at the 22, ratio was 8.8, and triglycerides were also at the higher level 101, where the low density lipoprotein was 152. These were the findings, and this is the routine hemogram where no abnormalities were detected. And we asked her to test for USG abdomen. Grade 1 fatty liver changes were there. Even the thyroid, to ascertain the thyroid profile, it was found absolutely normal. So here Samprapti Ghatakas we assessed like this, and Upashaya, these were the Upashayas where patient used to get comfort if the Guru Atarpana line of Upashayas were given, Vatagna Sleshma Medohara treatments were given, and if Udvartana is given, and if at all she involves in physical exercise, long walk, and all these things, then these can be considered as Upashaya. The treatment plan of a treatment is first we ask her to go for Deepana and Pachana for the period of 1 week, then followed by the Sarvanga Udvartana and Sarvanga Bhashpasveda for 7 days, Udvartana and Bhashpasveda. And after the Udvartana getting done, we have started the Jivan Rekha line of a treatment. That is, we call it as antioxidant therapy. That is Murjita Tailapana for the period of 6 days, and followed by the Shamana medicines for the period of 30 days. Now I will explain what is meant by this antioxidant therapy. Murjita Tilataila, Murchana is done with the special technique, and we named it as Dr. Sabnis Murchana process, where Murchana is done with the Lekaniya Ganadravya Siddha Auchadas, and these were packed into the different bottles so that the one time of intake can be easily done by the patients. So these are kept under 6 different bottles. Why? Because the oil is asked to consume for 6 continuous days. 60 ml of oil is consumed for 6 days continuously. And during this oil consumption, let us concentrate on the diet factors, how the diet is planned. Day 1 to day 6, patient is asked to wake up by 5:30, waking up and freshening up, taking 1 glass of warm water so that the GI mobility will be fastened. Next 6 to 7 a.m. mild walking for at least 30 minutes and mild flexible yogasanas for 30 minutes so that all the loosening exercises can be practiced. Then at 8 to 8:30 a.m. Tailapana with the warm water. The 1 serving of Tailapana is asked, patient is asked to consume 60 ml of 1 bottle of this Murchita Tilataila with lukewarm water. Suddenly in 1 cup or in 2 sips only, the patient used to consume this oil that is priorly heated in a vessel in a water, and that oil is to be consumed. Next 11 to 12 p.m. patient can consume the green tea. We ask the patient to consume, go for green tea, black tea or lemon salt water. 2 to 3 p.m. the patient if wants, then she can take the buttermilk of 250 ml. Next 4 to 5 p.m. once again patient can go for consumption of this green tea, black tea or lemon salt water. And we ask them to go for brisk walking or mild walking at the evening. And then at 7 p.m. to 8 p.m. we ask the patient is advised to go for 1 roti and dal. You see, this Tyler of 60 ml will never going to make the patient in fatigue condition. Patient will be absolutely all right, even though patient has not consumed anything. But the patient is, we need to, we see to that the patient is in a good hydrated conditions. As heavy amount of a fat is already deposited, there is no worry regarding the fatigueness or confining to the bed. Patient can go for routine works, and this oil, Murjit oil, will be working on its pathology, in destructing the pathology. We will discuss later. And meanwhile, these appetite centers and the hormone centers and the enzymatic actions are controlled by the action of this oil, so that the patient won't get that hunger pangs repeatedly. At evening, depending upon the hunger, patient can go for 1 jowar roti and moong dal. The desired amount of proteins in the form of a moong dal, that is a green gram sabji, can be given. And then patient is followed with this diet for a period of 6 days. Continuously for day 1 to day 6, patient is asked to stick on to this diet only, where the sabjis of this green gram can be varied. Either in one day they can go for this sabji with the red chili, in another day they can go for the sabji with the green chili with a little bit pinch of a salt, and curry, besan, like that, varieties of sabjis in a liquid form they can consume. The thing is, this much amount of a protein should go into the body, and this much amount of a carbohydrate is enough to serve the resting metabolism. Why? Because the patient is not doing the routine works, or even though she is doing the routine works, but no much expenditure of energy is there. So it is enough to maintain the resting metabolism, and hence this diet is planned for 6 days. Now let us see. After antioxidant therapy, this is the before treatment. At the time of before starting, the weight was 78.9 kgs. After antioxidant therapy, these were the, we are having Karada scan machine, very easily available machine, where the biomagnetic impulses are generated through the batteries, and these impulses will pass from the sole of the foot, and wherever the fat is there, these rays are obstructed, these biomagnetic waves are obstructed at that side, and the machine will take the reading. And these are the readings. There you can observe the fat percentage was 44.3, subcutaneous fat 42.6, and it has reduced to 42.1 front arm. Like that individual, the fat readings, the machine will take the readings, and later after 6 days, these were the readings. Now, follow-up data after antioxidant therapy is mentioned here. When the patient, not only the Carrada scan readings, you can observe the anthropometric measurements as well. Mid-arm circumference of right and left arms, mid-thigh circumference, mid-calf, abdomen, neck, chest circumference and all. We used to take the readings, waist and hip circumference. Now you can see the bit differences. Even the 1 centimeter fall is a good sign. Whereas after taking the antioxidant therapy for the period of 6 days of the treatment, you see here 9th patient has visited. From the 10th, she has started the medicine. 6 days of oil intake therapy. There is a reduction of 1 centimeter in each arm. This is a reduction in the circumference. Thigh circumference reduction of 1.5 centimeter. Reduction of 0.5 centimeter. Abdomen reduction of 2 centimeters. This we can calculate. The thing is, at the time of a patient visits the hospital for this reading, we used to take the photographs and give to the patient so that the patient can assure that the readings are with her or with him, so that no manipulation is done. At the follow-up, when the patient gets the next reading, he will be happy to see the difference in the anthropometric measurements and as well as the difference in the Carrada scan readings as well. So these are the, after this anthropometry measurements and Carrada scan readings, after the 6 days of therapy, the patient is asked to go for Shamanaushadis. The Shamanaushadis once again made up of the capsules and tablets. I will just tell what is meant by these, what are the contents of the capsules and what are the contents of the tablets here. Once again, Ganadravya Aushadis of Lekaniya Ganadravya Siddha Aushadis only. The capsules are formulated as per the medicines are prepared in total vacuum distillation methods and totally standardized. The medicines are totally, only herbal medicines are there, and tablets are also contains the same. For weight reduction exerting multiple mode of action, the medicine exerts. We will see how these medicines are going to act in the further slides. Now, as you start the capsule and tablets for next 30 days, 2 tablets twice a day, 2 capsules twice a day for the period of next 30 days. These will be exerting their lekana karma in the body along with some specific diet we advise, and where the weight reduction can lead to the looseness of the muscles and the skin tissues, and thereby this wrinkling and sagging of the skin can be managed by this massage cream and lotions. These are also provided, and massage oil is also given as a package box. And for the preparation of sabji, that is moong dal, rather than going for the routine oil, we asked them to go for olive oil. Along with the package, the olive oil bottle is also given. It is having a multi-beneficial effects, you might be knowing, when compared with other routinely used oils. It is giving a very good results. Now, from day 7th to day 30th, this is the diet what we ask the patient to follow. Like here, patient is asked to wake up at 5:30, 6 to 7 a.m. mild walking and yogasanas. 8 to 8:30, 2 capsules of the medicines, 2 tablets with the lukewarm water. 11 to 12, 1 roti and 1 katori dal. Same thing what we were giving in during antioxidant therapy. At 2 to 3 p.m., murmura popcorn or 100 grams with a pinch of salt and pepper. These can be consumed, murmura and popcorn. Why? Because the patient should get the fullness of the stomach, but the less calorie intake is managed here. Rather than going for, you might be asking that instead of giving this murmura and popcorn, the green salad would have been given. But the thing is, the green leafy vegetables are having some of the intrinsic factors, some of the factors which interferes with the action of these Lekana Ganadravya Siddha Auchadas, what they have observed, and hence completely green leafy vegetables were also stopped during the due course of the treatment time. Whereas in the evening, patient is asked to go for green tea, black tea, lemon salt water, and once again evening walking, and followed by 7 to 8 a.m., 8 p.m., 2 capsules and 2 tablets. Once again, the patient is given so that the serum, the medicine level of titration is maintained for 24 hours. And next, once again, the patient is asked to go for 1 roti and 1 dal or besan or curry. The thing is, protein supply is constantly maintained along with the sparing of carbohydrates. Here, the 2-time meals are given, limited meals are given, and the patient will not be having the heavy amount of hunger pangs, so that the patient will be comfortable for the period of 1 month, what we observed here. You see, now I will be showing this follow-up after the tablets and after the treatment and after the follow-ups. These were the reductions. Total reduction of nearly 5 to 6 kgs we are appreciating here. BMI also has come down from 36 to 34. Fat percentage has come down 44.3% to 40.3%. These were the machinery readings where the internal reduction of the fat is also assessed. The important thing is visceral fat, abdominal fat has come down from 22.5% to 21. Resting metabolism has come down from 1475 kilocalories to 1438. Body age came down from 76 to 70. So these were the machinery readings. Coming to the anthropometric readings, after the follow-up of the capsules and tablets, 27 centimeter was there, now 24 centimeter. So in one arm, 3 centimeter reduction was there after the due course of 1 month, nearly 1 month. 52.5, 48 centimeters. Mid calf 38.5, here 32 centimeters. 106, here 100 centimeters. 34 centimeters. Neck circumference 31 centimeters. And chest circumference 90, and it has come to 82. Now hip circumference 130.5 was the hip circumference. It has come to 118 centimeters. And anthropometric measurements were done with the same doctor, so that the errors are avoided, any bias, the observer bias are also avoided. And now coming to the laboratory investigations, the total cholesterol have come down to 140 because of the dietetic restrictions. What we have done, the fat sparing diet was there. Very low density lipoprotein has increased, it has enhanced to 25, and low density lipoprotein has decreased. That means the good fat is there, the bad fat is reduced, and the patient felt the lightness, able to do the brisk walk, easily perform the task without fatigueness. Reduction of the pain in both the knee joints were observed, and the treatment was concentrated basically on insulin resistance, hypothyroidism, PCODs, and excess of lipid peroxidation. So these were concentrated treatment, and this is the proprietary medicine, especially with the Lekaniya Ganadravya, which are mentioned in Charaka Sutrasthana 4th chapter. It exerts the anti-obesity activities by the different mode of action, and even the sesame oil, the Tilataila gunas are widely explained in Ashtanga Hridaya. The updated drug qualities can be understood like they are potent antioxidant, strong insulin sensitizers, thermogenic activity, antilipidemic activity is appreciated, which works on also neuropeptide. Now, specificity of the tablets and capsules, if we consider, these are the raw materials are standardized for each and every batch. Powdered and vacuum distilled extracts are subjected to granules, and tablets are prepared. These were the hydroxylation procedures is done over the sesame oil to increase the sesamol content in it. To increase the sesamol content, these all procedures are done. So the overall how mode of action can be understood is these medicines acted along with the calorie restriction. That's what the weight reduction is observed, where we have given the high fat in the form of Tilataila. Low, we have spared the carbohydrates, and low protein was also given. As the sesamol content in the Tilataila exerts its antioxidant effects, increased the all endogenous, 3 endogenous antioxidants. It has worked only on oxidized fats of the body and thus reduces the risk of lipid peroxidation, which leads to further metabolic disorders like the acanthasis nigricans, hypertension, diabetes, and insulin resistance. After 6 days of antioxidant therapy, herbal tablets are also having the diverse mode of actions. Let us see. And the diet, once again, the high protein, low carbohydrate, and low fat diet is maintained for the period of next 30 days. And the interesting thing is the green leafy vegetables and fruits are stopped. Why? Because the fruits are rich source of fructose, and once again, it stimulates the ghrelin hormone, that is the hunger hormone, and thereby the appetite would have been stimulated, and hence to control the appetite, the fruits are stopped. Enough amount of the energy is there as a stored fat, so no need to worry for that. Abhishanda causing foods are strictly avoided, and vidaranna sprouts are also restricted. So the mode of action of these formulation can be better understood by these things, like they are potent antioxidants, they are insulin sensitizers, anti-inflammatory action, which reduces the pre-inflammatory cytokines like interleukins, which are raised in obesity. We understand the obesity as a lipid inflammation. So these anti-inflammatory, pre-inflammatory cytokines like interleukins, which are raised in obesity, are reduced, and even the markers are tested. It reduces the ultra-sensitive CRP levels, regulates the fat metabolism, stimulates the satiety centers at the hypothalamus level. That's what the appetite will be in control, the hunger cramps will be in control. Phytochemicals like berberine, aptanent alkaloid, and immunomodulatory and anti-inflammatory property, these action can be appreciated. And it induces the thermogenesis and acts as an bioavailability enhancer, which increases the rate of absorption of other herbs also. It inhibits the inflammatory markers like NF-kappa B and TNF-alpha, which are raised in the obesity. And the drugs are having the low molecular weight, and basically they act on these components by the curcumin and sesame. And this is how the follow-up dietary advices are given like this. Up to the 30 days, these previously shown 2 diet charts were given. And after that, the maintenance diet is prepared here, as the madhudaka is also given in the morning. And some appetizers, shunti, dalchini, is given in the morning drink. And breakfast, we concentrated on complex carbohydrates. And next, midday drink was given, and lunch as such, the routinely available. The patient should feel the satiety, patient should feel happy, and all the materials should available in the market. With considering all these factors, we have formulated this diet, and many options were also given for the patients. And what not to eat, what to eat, these all instructions were given to the patients. Once the patient loses the weight of nearly 10 kgs, 9 to 10 kgs, definitely the patient will be conscious, and he never going to return to the what previous diet, quality diet, what he was practicing. Now for non-vegetarians, the brown rice or the complex carbohydrates can be given along with the boiled chicken breast pieces, 200 grams, or boiled egg white. In non-veg also, how the non-vegetarian food is to be prepared and what part is to be taken for the consumption. So all these instructions were given, and also this yoga intervention and routine interventions were also given. I will just show what vegetables are advised and what vegetables are avoided. And in individual Dwadasha Vargas, some of the advisable and non-advisable things, Patya and Apatyas, were mentioned. So next, in Vihar Rupi Patya, the sedentary lifestyle is completely avoided, and patient is asked to go for the set of yogasanas and pranayamas, where the protocol is developed not only by mentioning the name of the asanas, how much rounds, how much time, the complete protocol is developed, and that protocol is given to the patient. And this is the Charaka Sutrasthana, what the Lekani Ganadhara Siddha Aushadha, what he has mentioned here. So with these Aushadas only, the Murchana is done. So this is what the Jivan Rekha line of treatment, what we are following in this Sumedha OPD. And nearly since from 2019, we have seen 240 cases till date, and out of which we got a very beneficial results. We have taken the feedback of the patients also, and it is like this we are practicing with the Murshida Tilataila. This is the specialty practice in our KLA Ayurveda Hospital. So with this, I conclude the session, the specific Ayurveda management in concern to the Staulata as we practice in our institution. I thank once again the organizers for giving me an opportunity, and if at all any discussions are there, I heartily welcome the points to discuss with you. Thank you, sir.
Thank you, sir. Sir, there is one question. In the slide, there was mentioning of visceral fat, resting metabolism, and body age. So the question is how to assess all these three. That is, how to assess visceral fat, how to assess resting metabolism, and body age.
Okay. I would have brought those Karada scan video here. I would have shown that videos. You see, these what the findings I have mentioned here. What findings I have mentioned here? These are the findings which the machine has given the readings. Depending upon the scales, as I already mentioned, when you stand on that Karada scan machine, the biomagnetic impulses will be generated by the battery, and these impulses will pass from the sole of the foot to the whole body, and wherever the waves get obstructed, the machine will take the readings. So it directly tells that the visceral fat in the display, visceral fat is this much, like that it is showing, it was shown, and then we used to take the readings. And all these visceral fat, resting metabolism, and body age, which is calculated by machine. These are the machinery readings. Body age, optimal, if at all the optimal level of health is there for reference man and woman, if he is aging 50, then the body age should show as 50 only. But if at all the metabolism was lowered in him or in her, if at all any deformities are there, by calculating the fat content in the body, it shows the different body age, like that. We manually don't calculate all these things. The Karada scan machine will calculate all these things. Manually, only anthropometric measures are taken. Anthropometric measurements are taken.
Thank you, sir. Thank you, sir, for such an informative session. Especially there was a lot of information which is practically oriented, which is very much beneficial for our students, both UG and PG scholars. Now I request our beloved Dean, Dr. Rajesh Udupudi, sir, to say a few words on this occasion.
Namaste, sir.
Namaste, namaste. Yeah, good evening, everyone. Dr. Patil has briefly told everything about the how best Ayurvedician can do the treatment or the management of Staule. I'm very happy. As from last 2 decades, Staule is becoming motherhood or the platform for many diseases. So you go to any problem with the Staule, apart from the diabetes, the doctor normally says reduce the weight. It may be liver disorder, respiratory, or cosmetic problems, skin or infertility or sterility. So when I was doing PhD for 5 years, I treated around 3,000 patients in Kahir, that's KLE. I was very happy that we can have a lot of medicine Shodhana Shamana to treat the obesity. So what I feel, 50% the medicine is diet, 30% is exercise, what you advise, and 20% is medicine. Okay. Without diet and not burning the calories, medicine or the Shodhana will not work out. And Dr. Ashok told everything in detail, the parameters. Yeah, definitely. But nowadays, after a decade working or 2 decades of working, all those again, weight only counts. Weight and the especially BMI. So when patient says they themselves diagnose, I'm obese, and when they get a good response, weight reduction, they only say prognosis from their mouth. And we have to think preventive aspect, because obesity is a platform for many disease, CVD, CVS or CNS. So preventive cardiology, preventive obesity, preventive respiratory disorders, we can work out. And he has given a very good information to the audience. And in future, we have to cut down what best ahara and vihara can be adopted in the lifestyle. And this is a very good message for the budding doctors. Greater is the wealth, lesser is the life. So waste, if when you become when you join internship, you'll gain 2-3 kg. When you start your own clinic, you will increase 5 to 10 kgs. So greater the wealth, lesser the life. So with these words, I conclude. Thank you. Thank you.
ಅಶೋಕ್ ಸರ್ ಹಲೋ ಆಯ್ತಾಯ್ತು ಓಕೆ ನಿಜನಾಗಿ
Thank you, sir. We are at the end of the session. I request Dr. Shalini, Assistant Professor, Department of PG Studies in Swastha Vritta, to render the vote of thanks.
Good evening. Pranams to His Holiness Mahaswamiji. I take this opportunity to render the vote of thanks on the occasion of World Obesity Day 2022. We are privileged that in spite of his busy schedule, our today's guest speaker, Dr. ASHOK Patil sir, accepted our invitation and made this event possible and shared his valuable knowledge and clinical aspects with us. Thank you, sir. I extend my sincere thanks to our beloved principal, Dr. Sarbeshwarkar, sir, for his constant support. I would like to thank Dr. P. Sudhakar Reddy, Professor and HOD, Department of PG Studies in Swasthavatta, for making this event happen. I thank my colleagues in the department, Dr. Sankan Gowda Patil, Dr. Soumya, Dr. Pooja Hassan, for their continuous efforts. In precise, I would like to extend my thanks to all our UG students, PG students, teaching staffs, non-teaching staffs, AOs of hospital and college for their participation and support. Thank you, one and all.